Hello and welcome to an exploration of counseling and EMDR. My name is Danielle Porch and my fellow presenters are Lindsey Pfenninger and Heather Quinn. We are students in the Masters of Counseling program at Colorado Christian University, and this presentation was created for counseling services and methods. Today we will be discussing a brief history of the counseling profession and the educational requirements to become a licensed professional counselor in the state of Colorado. We will then focus on a type of therapy called eye movement desensitization reprocessing, otherwise referred to as EMDR. We will explore the history and purpose behind EMDR therapy, in addition to some of the professional associations created for EMDR practitioners. Furthermore, we will take a look at a current practitioner of EMDR therapy and learn about what it looks like in the counseling profession. As fellow students, we hope that you learn something during this presentation and perhaps discover a new area of clinical interest as you continue to pursue your counseling degree. First, we will cover a brief overview of the impetus behind modern-day counseling. During the 1800s, there were a number of societal influences that converged, which came to be the foundational building blocks of modern-day counseling. Due to cultural shifts and large numbers of immigrants making their way to the U.S., vocational guidance became a more extensive need amongst the populace. Along with vocational questions, this era saw an increase in testing and assessment as it helps clinicians to more aptly evaluate individual interests and skills. Additionally, the ideas of psychotherapy became increasingly reputable, and many began to believe that psychological factors were at least partly to blame for mental and emotional problems. Finally, many people within the helping and educational professions became increasingly passionate about treating those with mental illness more humanely. Here you can see that modern-day counseling is just one piece of the psychotherapy pie. Within the counseling profession, there are numerous specialties and areas of focus. You can see these specialties listed on the slide along with some of the more common professional associations for each specialty. Important to note is that all counselors, regardless of specialty, are able and encouraged to become members of the American Counseling Association, otherwise referred to as the ACA. This professional association currently boasts of 55,000 members and sponsors 20 different divisions of counselor specialty associations. As students, it is important to be aware of some of the benefits of joining professional associations. Things like conference and training opportunities, malpractice insurance, access to newsletters and journals of interest, potential mentoring and networking opportunities, and most importantly, job banks. So if you have not yet joined the ACA or your state-sponsored counseling association, I would highly recommend you do so. Here we have provided a brief overview of the educational requirements to become a licensed professional counselor in the state of Colorado. We all are currently students of a program that has been accredited by the Council for Accreditation of Counseling and Related Educational Programs. This will make it easier for us to obtain supervision, licensure, and employment. Please note that in the state of Colorado, 2,000 hours of supervised psychotherapy practice is required, in addition to 100 hours of direct supervision post-graduation in order to apply for licensure. For further information, you can check the Colorado Department of Regulatory Agencies.
Now we will discuss eye movement desensitization reprocessing, commonly referred to as EMDR. This treatment approach, which targets past traumatic experiences, current triggers, and future potential challenges, resolutions, the alleviation of presenting symptoms, a decrease or elimination of distress from the disturbing memory, improved views of oneself, relief from body disturbance, and resolution of present and future anticipated triggers. There are 8 phases to EMDR therapy. The first phase includes the client history and treatment planning. The counselor reviews the client's full history in order to develop a treatment plan and assesses the client's readiness and commitment to change in the treatment. Phase 2 is where the counselor and client begin to build their professional rapport. They will develop the expectations and goals for treatment. Since EMDR does bring up the traumatic and stressful events in the client's life, Phase 2 is where coping skills and calming techniques are developed. The counselor will need to remind the client to utilize those skills as they work through the other phases. Phase 3 is where the client begins to process the traumatic memory. The client will be asked to describe a visual image associated with the memory. For example, the client might say, "My mom's angry face," or "a dark room." The client will then be asked to describe a negative belief about themselves because of that image they stated before. For example, "I'm worthless," or "I'm not worthy of love." The counselor will then have the client identify a positive belief that they desire. This could be that the client wants to believe they are good enough or still worthy of love. The final portion of phase 3 is having the client rate their distress level. By doing this, the counselor will get a baseline to gauge progress. The client will also be asked to identify where in their body they feel a sensation when their trauma is triggered. This could be butterflies in their stomach or pressure in their chest. Phase 4 is when the bilateral stimulation begins. During the phase, the client will be working through the traumatic event. The counselor will need to focus on the client's breathing and body language, reassuring that they are safe and to use their skills they identified during phase 2. The coping skills will help the client from disassociating and keeping them working through the set. Phase 5 begins when the client can now access the memory without being negatively triggered. They can access their original memory in addition to the positive cognition. The positive cognition was the positive belief they identified in phase 3. Phase 6 is completed by completing another body scan. The client is asked to identify any tension while thinking about the original memory. The client must be able to think about the memory without having any negative sensation in the body. If so, the processing is not completed. During phase 7, the counselor determines if the memory has been processed and assists the client in self-calming techniques or coping skills. Phase 8 is when the counselor determines if the treatment is maintained and assesses for new triggers. Dr. Francine Shapiro discovered EMDR in 1987 using the theory of adaptive information processing, or AIP. AIP believes there is a memory network that ties old memories to new memories, which creates a knowledge base. If the negative experience is not processed appropriately, it has the ability to compromise the new positive experiences due to tying them with the past negative experiences, therefore creating an unhealthy cycle. There are several different techniques that can be used to accomplish the bilateral stimuli. Lateral eye movements from side to side is the most common way to accomplish this. A client can watch a light bar following the lights, or the counselor can move their hand back and forth for the length of the client's shoulder width and have the client follow with their eyes. Another technique is hand tapping. The client will focus on tapping their hands, alternating sides, to create the bilateral stimuli. Finally, the audio stimulation is conducted by the client wearing headphones that alternate the sound from ear to ear. This too will create the bilateral stimuli. The client will focus on the negative event while completing this exercise.
There are 3 associations that we will discuss in this presentation that advance the field of EMDR. The EMDR International Association is a professional association where EMDR therapy practitioners and EMDR therapy researchers seek the highest standard for the clinical use of EMDR. EMDR therapy is an accepted psychotherapy by leading mental health organizations throughout the world for the treatment of a variety of symptoms and conditions. The EMDR International Association was charged with setting standards for training, providing ongoing professional education, providing a forum for discussion, and the development of EMDR therapy, and encouraging quality research. The EMDR Research Foundation is the only organization worldwide dedicated to the study of EMDR therapy. Founded in 2006, the EMDR Research Foundation is dedicated to the promotion of quality, unbiased research in EMDR therapy. In an effort to inform, strengthen, and expand the understanding and effective use of EMDR, ultimately the Foundation enhances the quality of life for people everywhere by facilitating healing, health, and well-being. EMDR therapy is an evidence-based psychotherapy effective in the treatment of a variety of symptoms and conditions, and research is essential for expanding our understanding and application of EMDR therapy for different populations and issues. This association's purpose is to increase the availability of quality EMDR research where more evidence is needed in areas like anxiety, depression, military PTSD, phantom limb pain, and to enhance recovery from the impact of cardiac events and the diagnosis and treatment of cancer. EMDR Humanitarian Assistance Programs, or HAP, began in 1995 as a response to the Oklahoma City bombing. An FBI agent who had previously received EMDR therapy called requesting help, stating that the local mental health professionals were overwhelmed by the task. After a needs assessment, approximately 100 volunteer clinicians trained in EMDR therapy were rotated in to provide pro bono treatment for the bombing victims and frontline responders. A program evaluation indicated that over 80% achieved beneficial treatment effects within 3 sessions. Subsequently, free trainings in EMDR therapy were offered and provided to 290 clinicians in collaboration with local agencies. The feedback was so positive that a 501c3 organization was soon established. Teaching mental health professionals and lay populations such as teachers, nurses, and monks, EMDR therapy provides them with a means of treating the emotional effects of trauma in an efficient and effective manner. They train local clinicians as familiar and trusted members of the affected community rather than outsiders. And these professionals have immediate rapport with the victims that helps to further increase their outreach. In this way, they are better prepared to respond when disaster strikes. Training local clinicians helps to circumvent the problems caused by delayed international responses to traumatic events and build sustainable resources in communities often plagued by natural disasters or the effects of violent conflict. To date, there are over 30 EMDR organizations throughout the world, from Australia to the UK, all of which testify to the effectiveness of EMDR. As more clinicians are trained in EMDR, we move closer and closer to creating global healing, health, and hope.
We interviewed Erica Segovia, who is a licensed practicing counselor candidate who currently works at Ridgeview Youth Services Center in Watkins, Colorado. Ridgeview is a juvenile services center for male juveniles from 11 years old to 21 years old for both Division of Youth Services Youth and Department of Human Services Youth. Erica currently practices at the facility as the only EMDR provider. One of the questions we asked Erica was, what steps does one need to take to get EMDR certified? The basic training includes 2 weekends, Friday, Saturday, and Sunday. To complete the certification, the individual will obtain a total of 20 hours of group supervision, 10 hours of individual supervision, 50 hours of actual EMDR practice with at least 25 different clients. A counselor will have to also complete a specialty training such as disassociation or play therapy. Although EMDR is not seen any differently through the eyes of Medicaid, Erica expressed that as a counselor who practices both traditional therapy and EMDR, she has very different experiences. She expressed that when she has completed a session with an EMDR client, she feels more physically exhausted to the point where she is unable to complete her notes directly after the session. We asked her how she implements self-care into her routine due to the intense sessions she completes. She states that she ensures enough time between sessions in order to decompress from one session before carrying on to the next.
We sincerely hope you learned something new and that you now have a preliminary idea of what eye movement desensitization reprocessing has to offer your future clients and maybe even yourself. We appreciate your time and attention.